Joining me now for analysis is Rupali Limaye. She is with the International Vaccine Access Centre at Johns Hopkins Bloomberg School of Public Health. Thanks very much for your time, Rupali. Now, tell us more about this threat of the triple pandemic. Or triple endemic, what are and where is it hitting hardest?
Thanks for having me. It's been a real challenge. We've seen a huge increase in RSV. RSV typically affects young infants. It also affects older adults, and we're starting to see a lot of activity around RSV a bit early this season. In addition to that, we're seeing huge increases in influenza, particularly in the United States. Almost every single state is either in the very high or high category for influenza activity as of this last week. And then, of course, we still have COVID. And the issue with COVID is that we don't really know how many people are testing positive for COVID, because a lot of people are just doing at-home tests and they're not necessarily reporting that result or their status to a healthcare facility or a clinic. So it's just hard to tell, but we do know there's lots of COVID activity also going on.
And I imagine that a lot of this symptoms would be quite similar between the viruses. How can parents or adults who are sick differentiate and detect the difference in symptoms and which illness they've got? And how can experts strike the right balance between raising awareness among caregivers and managing the fears that many might have that might also morph into over-concern and too many people heading to hospitals?
I think the biggest issue is that we don't want to scare anyone, particularly parents that have younger children. As I mentioned before, RSV specifically usually affects younger children, particularly those that are less than a year old. And one of the things that you'll notice with RSV specifically that's quite different than what you will notice with flu or COVID is a wheezing sound. That's really the way that parents can really identify if their child may have been infected with RSV. I think with regards to COVID, a lot of what we're seeing now is that a lot of people have the sore throats. They're still having a bit of the dry cough. But again, the great news is that we do have rapid tests that individuals can take to help them determine if it is COVID, or at least ruling COVID out. Influenza is a little bit different. That typically is accompanied by sort of the cold, the chills, a fever, etc. As you mentioned, a lot of these symptoms are universal across these three different issues that we're currently dealing with right now. And so it can be really hard to figure out what is what. The most important thing for parents, I would say, if there are concerns, is to definitely reach out to a healthcare provider, because we want to make sure that kids are not having any problems, particularly with breathing, which is of concern not only for RSV, but also for COVID.
Now, a lot of hospitals are struggling at the moment with this triple threat. There's been a mass exodus in healthcare workers, and paediatric wards have shrunk and some have closed to make way for more profitable adult beds. How is the state of the healthcare industry impacting this crisis?
I think the state of the healthcare industry has been really concerning for a long time. We heard this from healthcare workers since the start of the pandemic, and they didn't really get a lot of relief, to be honest with you. There was a lull in terms of number of COVID cases that healthcare workers were seeing for a while, but we're hearing from many different hospitals that they're essentially at maximum capacity right now. We haven't even really started into what we typically see at least higher levels of respiratory disease activity, which is typically more around January. We're only in December. We just started December, but we're already seeing really high levels. And a lot of folks are essentially saying that they are at capacity. One thing that we have heard is that if it is not an emergency, to unfortunately not bring your child to the ER because of the long wait times. And so I think it's a really overburdened system that unfortunately I think is just going to get worse as the winter months continue.
All right, Rupali, really interesting to get your insight. Thank you so much for your time. Rupali Limaye, there's the International Vaccine Access Centre at Johns Hopkins Bloomberg School of Public Health.